your perceived I never supported all of it. Everything that I don't know if I supported over 5 ago. Well, like 12 class engineering. Focus markets online network follows out there. Actually, the one who's right for you. So for yourself, visit betterhelp.com/breastplay for 10% on your first line.
Hello, everyone. I'm just going to wait another moment, maybe 1 or 2 more minutes, see if any additional people come in, and I will share my screen in the meantime. Hold on, wait. All right, I got 6:01 on my end. I'm going to go ahead and start. If you have any questions, please feel free to drop them in the chat, or you can wait till the end. I would prefer to the end if you don't mind. Normally, my supervisor gives this presentation. However, she's out of the country, so I will be doing it. Please let me know if you can see my screen. All right. We'll go ahead and get started. My name is Ebony Terry. I'm the technical assistant for the health science non-degree programs. We have a variety of medical programs in the non-degree sector, including all of the ones you see here. We have a central sterile processing technician. That is a very popular one for our area. We have a lot of dental programs, medical billing and coding, EKG, group and personal fitness trainer. I will not list every one of these off, nor will I be reading every slide. I'm just going to summarize and give some supplemental information. So the format of our classes are usually either seated, which is like a traditional come to campus sit in class, online. There are no specific meeting times. You just log on, do your work at your own pace, as long as you meet the due dates provided by the instructors, and hybrid and blended, which those will be some online work and some in-person work. So the workforce non-degree programs, we specialize in standalone classes, which will lead to a certification of some sort that will allow you to enter into the workforce. You will not leave with an associate's degree like our curriculum counterparts. They're standalone classes designed to put you into the workforce. Our course costs range from 180 to 250, sometimes a little bit more depending on the class. If you have a clinical component, you have to factor in for transportation as well as the book. Most of our courses can be completed in as little to 2 months and maximum about a year. We do offer one financial assistance option. We do not have traditional financial aid options as our curriculum counterparts. So that means no, like, what would you say? Like work study or grants. What else would you say? Like loans. Anything with your FAFSA does not apply here. However, you can apply for the Propel Scholarship. And if you want more information about that, please go to this website. They did just reopen the application October 1st. All questions about eligibility requirements and the status of your application They can be sent to them. They have an email listed on this site. It is WCE resources at waketech.edu. So a good place to start if you're interested in a healthcare career. I always like to recommend medical terminology, Intro to Anatomy and Physiology. It is required for some classes, not for all classes, but if you're going to be working in the healthcare field, it's a good thing to just have. It's a great foundation. If you're interested in healthcare but don't know exactly what area of healthcare, I suggest checking out our career services. They do have exploratory courses and they're all free. They're just short-term classes that allow you a more in-depth look into the healthcare field. And we also offer BLS for the healthcare professional, CPR through American Heart Association. We offer these classes quite frequently, and some fields and some classes do have those as a prerequisite. So if you don't have it, you can check out cpr.waketech.edu and sign up. I will have the contact information for the CPR point of contact at the end. So circling back to career services, they have a workshop offered monthly. It's about is healthcare the right fit for me? And it will help you explore career options and learn more about courses here that can help you reach your career goals. Like I said earlier, it is a free workshop. The fee is waived. If you are able to scan this QR code, feel free to do so at this time. If it is not working, you can visit this website. It looks a little odd on my end, so it may not scan. I suggest just going straight to this website to look at the courses they're going to offer. This is some of the courses that they will be offering related to healthcare. They are coming up soon. We have dental assisting and dental hygiene. Dental is a very popular field and a excellent program at Wake Tech. We actually have another session going on right now being hosted by Brooke Brayboy. So if you all are interested in dental, I suggest to listen to her presentation. We also have a session about math essentials for healthcare careers coming up in January, social and human services, as well as neurodiagnostic technology. Please visit cpd.waketech to register. And if you take the course and are still a little unsure afterwards, they do offer a drop-in lab at most Wake Tech campuses. Walk-ins are welcome and it is free once again. These are all of the locations you can get the career services career coaching done at. I've listed all campuses, the building number and room number if applicable, and the day and time. So I'll pause here for a brief moment in case anyone wants to jot this down or take a screenshot. Yes, that is all 7 of our campus locations right here. And the days and times of the free drop-in career coaching. All right, so I'm going to get into some of the programs that we offer. We offer quite a few. Like I said before, I will not read it everything exactly from the slide, but I will give a little supplemental information. Our most popular class is the Central Sterile Processing Technician. This is a high demand career. I see lots of jobs posted for this position in particular. I see something for Wake Med, UNC. This course is a hybrid course. It's majority online, and there is an in-person meeting night that you must attend. And it takes a little over 3 months. I'd say about 3 months and some change. Once you finish this course with successful grades, you will be eligible to take the Central Sterile Processing exam. Clinical research, as you all know, we are in the research triangle. It is one of the best places in the state. I would dare say the country, but don't quote me on that. Yes, we're one of the best in the state for clinical research, and we have a few classes offered about clinical research. I think we have a few more. I didn't list them all, but two of our most popular are the monitoring clinical trials, as well as the healthcare clinical research specialist. So if you're interested in research, please look into those classes, the clinical research section. We have community healthcare worker. We recently started offering this class in English and in Spanish. So if you are bilingual, feel free to sign up for this class. This is more, I feel like this class in particular is good for people who are interested in, I'd say, social work. That's a very important area of healthcare, often overlooked. This course does include CPR already in it, so if you are interested in this, you do not need to pre-take your CPR. You will get certified in the class. So I think that is a plus of this class. This class also features a mental health care component, which mental health is a very growing problem in the United States, and we should have a little more, I don't want to say focus on it, but it needs more research done and more workers in the field. So I really like the community health worker class. They cover a lot of stuff. I highly suggest it. We have a lot of dental assisting classes in the non-degree programs. These classes are more so geared toward if you are already a dental assistant or a dental hygienist. However, I do believe anyone can take them except for it's a few that there are specific requirements, like you must be CPR certified and have a class, a 3 hour infection control class and stuff like that. So always read the course requirements before signing up because there are some exceptions to this. And there will be more classes offered in the dental field soon next year. We have an AI in dentistry class coming up next semester that I'm very excited about. But once again, like I said before, if you are interested in dental assisting, hygiene, if you want to be a dentist, anything at all with the dental, we do have another session. Brooke Rayboy is hosting it right now at the same time I'm hosting this session. If you want to leave and go to her session, I will not be offended because she will be able to go more in depth about this field. Dental billing and coding, still relating to the dental, but a little less hands-on, more of, I would say, paperwork side, computers, if you're into more insurance focused. This outline includes dental terminology. There are some very specific dental terms that most people do not know unless they went to dental school. So I do suggest, unless you went to dental school or are actively a dental assistant or hygienist, to take the dental terminology if you're interested in this. And then after you take the dental terminology, then you can take the dental billing and coding. These positions are in high demand, as well as medical billing and coding, which I think will be featured a few slides down. Oh, just kidding. It's featured right now, the next slide. Our medical billing and coding program is very popular as well. It's a three-course program. You start off with medical terminology, and then the billing and coding are separate for medical as opposed to dental because medical encompasses a whole lot more. Let me think, are there anything special I should mention about these? There is this class, well, this program takes a little bit longer because it's three courses and they're about 3 months each. So it's roughly 9 months. So as I mentioned earlier, how it could be between 2 months to a year. This is one of the ones that's closer to a year. It's not quite a year, but it's about 9 months, give or take. We are going to be offering next semester and potentially all semesters, so on from that point, if they are successful. We're trialing a 8-week medical terminology class. We have a professor who is willing to teach it, so that will shorten the time by a little bit. So if you're interested in medical terminology, we will be having more sessions of that soon. EKG technician, this is a very popular program as well. Medical terminology is recommended prior to this. You also must have a high school diploma or equivalent, but this is a growing field. You're learning mostly about the heart rhythms, how to read. There is a name for the squiggles, and I can't think of it at the moment. You will learn the actual name of the squiggle once you take the class. And this class is very popular as well. We will be having more of this next semester. Fitness trainer, we offer personal and group fitness trainers that are credible with the American Council of Exercise. And we're hoping to start a pain-free performance class. We don't have that class on our books as of yet, but it is scheduled. The fitness trainer class is all online. We offer an introduction to medical sonography class. This class is pretty popular as well. Wake Tech does have a medical sonography degree program. If you are interested in applying for that program, you can take this class first to see if you really like the field of sonography before you get too deep into it. And also, if you do find that you do like the field and you decide to apply to Wake Tech's medical sonography program, you will earn some points on your application. They do use a point system to determine who gets in or not. This is online as well. This is a very popular class. Moving on to massage therapy. Who doesn't love a nice massage? This is a good field if you're interested in exercise or kinesiology. If you just want to learn more about the body in general. Anatomy, physiology would be helpful for this sort of class. And the program contact for this is Nancy Harrell, and I have her info right here. I'm going to pause for a moment in case anyone is interested in massage therapy. Please write this down. Nancy is your go-to person for any questions about massage therapy. She makes all the decisions about who gets everything. She is in charge of the whole program. This is underneath my department, but any questions can go to her because even if you were to ask me, I would end up asking her. We have a medical scribe class. We just started a section of this fall. Medical terminology is a prerequisite. And this class will teach you how to chart physician-patient encounters during exams and procedures. I see a lot of positions for this at UNC and WakeMed also. This class is online. One of our newer courses we're going to be offering soon is the mental health technician. As I mentioned earlier, mental health is on the rise in the United States, and we need more people in this field. So I'm very happy that we are going to be offering it. This is a good course to take in concourse with the community health worker. However, you don't have to take them both together. You can take them separately, or you can just take this one by itself and you don't have to take the community health one at all if you just want to learn more about mental health problems throughout the life cycle and how to overcome those problems and how to work with people diagnosed with mental illness. If you're a social worker or interested in social work, I think this would be a good class to take to broaden your knowledge. Neuroanatomy and physiology. These are some classes closer aligned to our neurodiagnostic technology program. You learn about EEGs and neurons and nerves. I believe the only class we have at the moment for the neuroanatomy and physiology is an EEG review. We are hoping to get some more into the future. However, if you're interested in neuroanatomy and physiology or in neurodiagnostics, please reach out to Rebecca Rendall. She is the point of contact person for that program. The nurse aide, this is a very popular class. A lot of the programs here at Wake Tech do require you to be active on the nurse aide listing for North Carolina. They also had a presentation as well. It was at 5 o'clock. So if you were interested in this, I hope you attended. They will be able to answer any questions you have. I will also have their contact info at the end because they're technically part of our department, but they are their own department because they are so popular. We also offer pharmacy, and our pharmacy program is booming. It's a 2-part class, Pharmacy Technician Training 1 and 2. Next semester, we're hoping to offer the Introduction to Pharmacy class for people to determine if they're interested in pharmacy, and then if so, they can move on to Pharmacy Technician Training Part 1 and 2. You will need your CPR for this class, as well as a physical from a healthcare provider and proof of immunizations. Our pharmacy training does include a clinical component where you will be going to a pharmacy and learning hands-on with a pharmacy technician and licensed pharmacist. We have a section of this part 1 and 2 for next year posted on the website currently if you are interested. I believe there are a few seats left. So if you're interested in that, please go to our website and read more details. Phlebotomy is a very, very, very popular class in our department. Our phlebotomy program is 12 weeks, with the first 8 weeks being the lecture and didactic portion, and the last 4 weeks being a hands-on clinical portion. So you will be going out into the community, into the hospital, into the clinic, wherever the clinical site coordinator places you. And you will be studying actual people and drawing their blood. You may be collecting urine samples, whatever they need you to do. There are some important requirements for the phlebotomy program. You do have to be CPR certified. You do need a physical from a healthcare provider and proof of immunizations. And you must be 18 years or older and have your high school diploma. Medical terminology would be helpful for this class. It's not a requirement, but if you're going to be in the healthcare setting around all of the healthcare people and they will be making notes and things like that nature, they're going to be using medical terminology. So our phlebotomy class, we have sections for next semester. They're both currently full at the moment. And this is a blended class, so it will be partially in person and partially online. Some classes that are in the works right now are the disability support specialist, mental health first aid, medical interpreter, perspectives on child maltreatment and advocacy. And I think the perspectives on child maltreatment and advocacy could be very beneficial and a nice supplement to the community healthcare worker or the mental health technician, as well as many, many others to come. We're also working on a surgicological technician because we've had a few requests for that. And I heard we have done that class in the past. So more to come. I'm listing the department contact information. My department, which is the non-degree allied health department. This is our email address and our phone number. the nurse aid department, because that is a very popular department. This is their email address and phone number. If you need CPR for any of the programs you are interested in, any of the classes you're interested in, the contact person for that is Gabrielle Robinson. This is her email address and phone number. And recently we have been getting a lot of questions about EMT, which is medical. However, they fall underneath the public safety section. But if you are interested in EMT, the contact for that is Kim Miller, and this is her telephone number. I mean, not her telephone number, I'm sorry, her email address. I don't know her phone number. Email her if you have questions about becoming an EMT. All right. I will take questions at this time. Are there any questions?
There are quite a few, Miss Terry.
Okay.
I'm going to try and synopse, but folks, feel free to open up and ask directly. The first one that I did not have an answer to was a minimum age for central sterile processing. Do you know if there's a minimum age requirement like there is for nurse aid?
Oh my goodness, I just opened the chat. Oh my goodness. I do not believe there is a minimum age. I think you can be any age.
Okay,
I think you have to be at least 16 to take classes at Wake Tech, if I'm not mistaken.
correct. Yep.
So I would say 16 and plus.
Okay, and then a couple people missed the sterile processing technician. I don't know if you could jump back and just take a peek at those real quick while you're looking at the chat. I know that's multitasking a bit, but they asked about that.
Okay, I'm gonna just scroll to let me see. Okay, what was that address you just spoke about? Okay, sorry. Okay, so I see what is minimum age. Is there a link to the free office hours for career coaching?
I got that one.
Okay, thank you so
That
much,
one.
Mike.
Then next they're interested is sonography. And I don't know I don't know the answer to that one at all. So that one you may know.
My question was if when do the classes open for that?
For the sonography?
Yes, ma'am.
Let me see. I feel like it was a little bit ago. Let me double check my email. I think that was actually, what is today? October 22nd. Let me see. Around early September was when we posted this current section that I believe started. When did it start? I think it's already starting. I want to say it's 8/25 through December. Yeah, let me see. We sent out the notification for that late August. I think it was, actually, I remember now. It was very close to the start date. We sent out the notification email on the 19th and it started on the 25th, which normally is a very uh tight turnaround, but because there was so much interest, we knew it would fill and it actually did.
Okay. So do you know when the next semester will be posted?
Let me see. We are currently working on the 2026 offerings.
Oh, okay.
So I don't have the concrete dates at this time, but I know we're going to have that one. Are you signed up for our notification list?
No, ma'am. And how do I do that? Sorry.
Sure, no problem. Hold on. I'm gonna share so everyone in the chat can see. Let me see. Here we go. I'm on the page of our wonderful non-degree virtual open house. So I'm going to show you all where you can sign up for notifications if you're interested in any of our courses. So I just hovered over menu here and I'm going to click on workforce training. These are all of the workforce classes we offer. I'm going to click on healthcare and wellness. The medical sonography falls underneath imaging training. Let me see. This is the course that we currently have that's going on now, and it's a Wake Text Notify Me service. You can click here. Wake Tech will verify that you are human, apparently. It's awkward. I wasn't expecting it to verify me like this. And then you'll just fill out this form right here. And when we post the next class, you will get a notification.
Okay, thank you so much.
You're welcome. Okay, let me go back to the chat, see if I missed anything else. I see something says
Somebody
BLS
said
for
in
the.
pharmacy tech. Somebody said in pharmacy tech, how long or wait, where do they go for hands-on training?
Um, I believe typically a CVS or Harris Teeter pharmacies, the department head, she picks all the clinical locations and assigns them per student. But it's typically a retail pharmacy, like how you would go into CVS or Walgreens, Harris Teeter. Okay, hold on. I'm seeing some more in here. Someone said BLS for the HCP CPR. What does it mean? It's That's a CPR, and they have a special CPR that they do for healthcare providers as opposed to regular civilians. That's all that is. The cost of the class is the same. Somebody said disability support specialist interested in that. Oh, okay. I'll write your name down, Kelly. Hold on. I do have a notebook here in case y'all had some questions I couldn't answer because my supervisor is out of town and normally she runs staff. Okay. Let's see. Can you work weekends? No, can you work evenings and weekends after phlebotomy? We do normally offer a day class and an evening class. So if you manage to get a seat in the day class, you could work evenings and weekends. However, for the clinical component, the schedule is not guaranteed. We don't post the schedule because every student's schedule is different. You and your preceptor will work on your schedule once you get assigned. So as far as working during that part, I cannot say. You would have to have a very flexible job because you must have a certain number of hours in that program. And even if you get all of like your work done, say for example, I think you have to have at least 100 or 200 sticks. If you could get all 200 sticks in one day, but you still must have 106 hours, so you still have to fill the time slots of the hours as well. So it's basically a full-time job, so it might be a little difficult to work another full-time job while having it, but if you have a flexible job, you could potentially do it. What is the salary range for phlebotomy? Okay, let me see. I'm not sure. I think the starting salary I want to say is 12 to 15 an hour. Let me double check. Okay, it says the phlebotomy salary range in North Carolina varies. The average annual salary is about 38,000 a year and an average hourly wage of approximately 18. Oh, okay, that's great. So typical range, maybe 16 to 23, but it does depend on, like location, experience, employer, and stuff like that. Okay, let's see what else. Are there any more central sterile processing technicians? We will have more in January. We don't have the dates concreted as of yet, but I guarantee there will be more, Jordan. Okay, I answered Tawana's question about the hands-on training. Of all the career options you mentioned, which are the ones that you can work evenings and weekends? Ooh, let me see. I would say perhaps massage therapy. You could probably work that evenings and weekends. Let me see. Central sterile processing, you could probably do that evenings and weekends. Any others? Perhaps EKG technician if you work at a hospital, because hospitals are open all the time. Okay, let's see. Okay, Kelly says she took the CPR training. Oh, okay, then you're good to go, Kelly. Just make sure you have your card when it's the next nurse aid evening class. I do not know about the nurse aid. I listed their contact info. I think they do have 2 new classes posted actually, so you might want to check our website, Carolina. the next evening phlebotomy class, we are offering one in February, but that one is currently full. And we still register for classes if they already started in August. I don't know what class you're referring to, but I
Sorry.
do. I was saying, who is that?
Sorry.
That's okay. Did you have a question? I see your hand is raised.
Um, no, I was just asking about the nurse aid evening and the phlebotomy class. Thank you so much. I duly appreciate it. Thank you.
No problem, Carolina. Okay, I see someone named Jordan said, can we still register for classes if we do not recommend it because they have already started and we don't know how much work you will have missed, and there is a chance I will not know what grades you will make in the class because you will probably have missed some assignments. It would depend on the professor if they allow you to make up those assignments or not. Somebody said, what did you say opened up on October? I honestly do not remember what I said. We had a few classes starting in October. No, October. The medical scribe class started in October. If you sign up for a class, but if schedules change, can you drop the class? And if we do, will we get a refund? Let me see. Yeah, if you sign up for a class, but your schedule is no longer conducive to the times of the class, you can drop it. Let me pull up WakeTech's official refund policy though, because they do have a specific. Hold on. We are very specific. You can drop the class via self-service if you have activated your WakeTech account. Per WakeTech's refund policy, 100% refund will be given if the student withdraws from class by written request before the first class meeting, and a partial refund will be given if the student withdraws on or before the 10% date of scheduled hours. Community school, facility, and lab fees are non-refundable. But when you do register, the dates of the class are right there and the time. So I suggest you look at those very hard and intense before you actually press register and submit your money. Let me see what else we have here. Okay, thank you. Maybe a funding program, Propel. I saw one other hand raised, but it said unknown user. Unknown user, feel free to unmute
It's
and say your
me.
question.
Hello?
Hello.
Hello, can you hear me?
Yes.
I had a question. I'm interested in the mental health technician
Uh-huh.
program, and I was wondering when does it start and how much would it be for the program itself?
Exactly when we will begin that mental health program, but I believe it will probably be about $180 as the tuition. Let me double check my spreadsheet to see if we have that class listed. One second, I just pulled it up. Let's see. Okay, we potentially may have one starting in January 12th.
Okay.
Let me see if that's on our website. You may can sign up for the notifications. If not, I can just take your name and I can send you an email.
Okay. And is this 100% online for the mental health program?
I am not sure. Let me write that down. Mental health, is it online? It most likely is. Majority of our classes are online, but like I said, some of them do have seated components, so I don't want to tell you anything false.
Okay.
Is this you that just entered into the chat,
No,
Kelly?
I've been in there. I don't know who just
Oh, okay.
got
I
on.
saw somebody. Oh, okay. She just said she was interested too. Okay. I'm writing that down. Mental health class.
So we'll have to fill out the, I guess, application through the workforce page you were showing us, and then select the program. Okay.
Yes, the mental health one is on the website, and they do have a notify me as well.
Okay.
All right. Are there any other questions?
I have a question for you.
Okay, go ahead.
If we are currently taking, like if we're in a program, like a degree program, will that um, either help us or I don't know what word I'm looking for. Like, would that like, do they have? Does one have anything to do with the other?
Um,
Like, would I get credits for like for being in a, like if I wanted to do a mental health class, would I have credits because I'm already in a degree program, or does that not have anything to do with the other?
no, that doesn't have anything to do with the other. These are standalone, so
Okay. Okay. Thank you.
you're welcome. Okay, let me know if I'm understanding you right. You can take them both at the same time, like if your schedule permits. It won't like
Yeah.
interfere and you cannot take them.
Yeah. No, you understood correctly.
Okay. Does anyone want me to pull up the contact info page again? I had my department, I had nurse aid, I had CPR as well as EMT up there. If anyone wants the contact info.
Do you
Are
have
you
the
listed?
Ooh. We have multiple questions.
Sorry, you can go first. Sorry.
okay. Do you have the contact information for the mental health technician person?
That's my department. You can just put your name and email in the chat. I'll write it down and I will reach out to you.
My chat doesn't work on my phone for some reason.
Oh.
Yeah, it's saying it can't find you guys.
Cool. What is your name? I'll just write it down.
All right, it's Sydney with the C, Cydney. And last name is Jones. So it'd be my first name dot the last name, the number 10 at gmail.com.
Okay. You said first name dot last name and then 10
The
at
number 10.
Gmail.
Yes, at
Okay.
gmail.com. Yeah.
All right, I got you, Sydney.
Thank you.
You're welcome. Who is the second person? You can go ahead.
I was wondering, are you like with the sonography department as well? Like you're with that department?
I'm not with the sonography department, but we do offer a sonography class,
Oh, okay.
if that makes
So,
sense.
so who would I contact as like if I have questions?
Let me see. I believe her name is Megan Wilson. Let me double check, but I'm quite certain it's Megan. I had a little pink sheet. Now my pink sheet is gone. Yes, Megan Wilson. She's the imaging department head. And also, I saw somebody else say something in the chat as their contact person for radiology. She is also the contact for radiology. Radiology is a big department.
Can you put her email in the chat, please, or
Sure.
share her email? Thank you so much.
Yes. right, I have her info there. ML Wilson, yep. I believe that's over the, I want to say, radiology, mammography, sonography, and one other department. Did you see it? I typed it into the chat.
Yes, ma'am. Sorry. Yes, I see it. Thank you.
You're welcome. Well, if there are no other questions, I thank you all for attending. Thank you all for attending. Have a great night.
Thank you
If
so
you-
much.
Thanks,
You're
you too.
welcome. You have
Have a
any
good
other
night.
questions, please? You're welcome. Have a good night. Please reach out to the email address or phone number listed at the last slide.